I wanted to be a doctor since I was 6 years old, primarily a malignant hematologist with a specialty in lymphoma, which is what I am. So I guess I knew what I wanted since I was really little. I grew up in a small town, very similar actually, if you've ever seen the show Gilmore Girls. I was very much like a Rory of our town group, so I was always going to be an oncologist. When I was 5 years old, my father, who is an immigrant from India, was diagnosed with Hodgkin's lymphoma. He wound up going through treatment and doing quite well, but when I was 11, he relapsed with what's called treatment-related acute myeloid leukemia. And he was an incredibly brilliant man. My father sat me down and explained to me what acute myeloid leukemia was, and the words he used at the time is actually some of the words I still use to explain myeloid leukemia to my patients. And from then on, I just always had a real passion for science and really understanding the mechanism of disease. I lost my father young, when I was 11, from his disease, but really what I think stood out to me was the fact that when he was really not doing well, it was hard for a child to see, and so I would spend a lot of the time in the sunroom on the hospital floor, playing video games. And I remember there was one of these fellows, his name was Dr. Treader, and we would just play and just talk like normal. When my father passed away, it was late in the middle of the night, and Dr. Treader came in overnight and sat with me and my sister. Dr. Treader left a very lasting impact on my life, and I realized that there's so many ways as a physician you can impact and change people's lives and sort of pay it forward. And so, that sort of experience really led me to want to practice medicine. So I was sharing this with one of my mentors, and she had a similar experience with one of her college roommates. She's a world leader in the field of Hodgkin's lymphoma. Her name's Dr. Jane Winter. And so we were talking about how passionate we were about reducing side effects from chemotherapy, particularly for Hodgkin's lymphoma. And it was actually that conversation that led to the development of a clinical trial that we wrote together, evaluating a novel therapy called a checkpoint inhibitor prior to chemotherapy for Hodgkin's lymphoma. When I left to come down here after I completed my training, Dr. Winter said, "This is your trial, this is your baby, bring it down to Tampa General and bring it to the Tampa community." It was extremely important for me to go to a teaching or research hospital. The therapy that I specialize in giving, like I said, is called chimeric antigen receptor T-cell therapy. It's essentially where we take your T-cells out of your body, train them to fight your cancer, and then infuse them back into your body, and that's only given at an academic research facility as of right now. A lot of my relatives in India are actually in medicine. And so during my 4th year of medical school, I actually did an international medicine rotation where I spent a lot of time with my family and then practiced OB-GYN medicine. It was the first time I went back to visit as an adult. And so it was a really wonderful experience returning to India and being with my family, getting to see how they practice medicine and what an impact they have on their community was incredible. My husband always jokes, "Oh, this is my wife and she's gonna cure cancer someday." And I think it would be very aspirational to say that our goal is cure, and it is.